Hey there, it's Hoang with Hand Therapy Secrets. Welcome to my show. Today I am going to share with you a story of one of my students. She is in my hand exam prep and on her way to becoming a certified hand therapist. So she's got an amazing story of how she herself was a patient in the past and her journey to becoming a certified hand therapist. And I think that you're gonna get some great tips from this. It's a little bit long, I'm not gonna lie, but we had a fantastic fun time talking about a ton of things. If you're looking to break into the hand therapy world, there's two major tips, not just one, two major tips. And if you're not paying attention, you should, because this is how lots and lots of people can break into hand therapy. Increase your chances of moving your career in the way that you want to. So watch this. We had so much fun. All right, we are on. My name is Hoang, and this is, say your name, Roisin. Did I say that?
Roisin. Yep, Roisin Isley.
Perfect. So, you guys, I met Roisin in my hand exam prep, and she keeps coming up with like Hannah and Donna. She keeps coming in here, these calls with different names, and I never know how the hell do I say this woman's name? I mean, I have a hard name, so I totally get it. You know, it's some people call me Wong, some people call me One, some people call me Wand, all sorts of stuff. And it's kind of like, well, you know, just call me. As long as you call me, I'm okay. But it is important to really have people know your name. So I want to make sure, I make sure people know my name. I say my name Hoang all the time. I need my patients to know my name. It's really huge. I teach my therapists that all the time. Like, you want people to come back and say your name. Say my name. Say it. No, I'm not. Let me not do that. But so, Roisin, you're in my hand exam prep group. And during one of the calls, we got to hear a really exciting, well, it's not exciting, but we got to hear your story about your own types of medical injuries and stuff like that. And I'd love for you to share that, but then share your journey into becoming a certified hand therapist, because it's just really important for people to see other people doing what they want to do and not feeling like there's a limit. People are always looking for some kind of similarity, no matter what it is. Sometimes people come and they say, well, I feel like I'm too old to do this. You're not too old. I have people in this age bracket. A lot of people say, well, can I do this if I'm a CODA? You can get into hand therapy as a CODA. You can't do the certification, but you can get into hand therapy. And I've met along the way lots of CODAs turned OT, turned CHTs, so I wanted to showcase that kind of stuff. So tell everyone a little bit about you and where you practice and stuff.
Okay. Well, I'm Roisin Isley. I'm a hand therapist at Palo Alto Medical Foundation, which is part of Sutter Health Network in San Francisco, California, in the Bay Area. And I have been a practicing hand therapist for about 6 years. And I actually originally started in San Diego, where I went to grad school. And I moved up here about a year and a half ago and started Sutter Health. So I was with Scripps Health in San Diego at a little hospital, working under a mentor who mentored me for about the first 5 years of being a hand therapist. So wow, I got right.
You're one of those rare people that's someone helping you.
Yes, it was incredible. I actually had a CODA who had been a hand therapist for like 15 years in the same clinic as well. So she had her hands in helping me learn, as well as an established CHT. So
that's like
it was very
heard of, except for what I do here, but still.
Exactly. I was so like, I kept pinching myself over and over. The one cost that I had was that I worked in acute care and neuro rehab every Saturday. And so that was the cost.
Very
and I thought,
small price to pay. Very
not that
price to pay, right?
Yeah, I actually loved it. Yeah, I actually loved it because I love the fact that I was able to pull some things from hand therapy into the ICU
Oh my
or
God.
into,
So much. So much. Don't
yeah,
get me started. I am a care therapist at heart. I believe in being, diversified, and I love talking to OTs that are in neuro that want to kind of like specialize more in upper extremity types of issues, because all neuro patients, they end up with orthopedic types of issues, right? They're all mechanical types of issues that have a
yeah,
neuro, a neuro component, but hands are hands, man.
it's true. Oh my God.
Hands are
It's
hands, you know.
amazing.
So
Yeah.
you're one of the lucky ones and got a lot of mentorship. So how did you get into OT?
With OT, I actually had an injury that happened to me when I was 17. I was a couple nights from my high school graduation, and I had this plan and intent to be an equine veterinarian. Up until that point, I was into horses and riding and equestrian, all things equestrian.
Wow.
So I had applied to schools. I got into some schools in their agricultural science programs and things like that. And so a couple nights before high school graduation, I was riding in a car that was in the back roads of Kentucky, in Lexington, Kentucky, and surrounded by horse farms and big plank fences. And the car was going a little too fast, overcorrected a turn, and went through a fence. And actually didn't go through the fence. He shot like a bullet. He shot the car through like a bullet through a fence, through 50 feet of plank fencing. And one of the planks from the fence actually went through my shoulder, severed my shoulder, pinned it to the seat, and I was thrown to the back seat. And this is in the middle of the night in the back where there's not even a road light or a street light.
Nobody.
So there was a lot of things that were in
county with
exactly. And it just so happened that a retired EMT with a radio just happened to be behind us and saw it.
Crazy.
And so pulled over, dispatched the trauma center at the University of Kentucky, and they were able to come and airlift me and my arm back to the trauma center. And the actual attending trauma surgeon who was on call that night was kind of a harsh sort of personality, but all about business. Thank God for that. So he was able to, his main priority was to reattach my arm and reestablish blood flow.
Yeah.
The fact that all of my osteology was crushed, my brachial plexus was severed, I had no musculature, it had all been ripped out. He just wanted to restore blood flow just to be able to maintain my health. I lost about 6 units of blood the first night. And so he ended up he took my saphenous vein and replaced my axillary artery, put me up in an airplane. Well, it was an airplane splint, basically 90 degrees to maintain that axillary space and restore that circulation. And I stayed in the ICU for about 3 weeks, 3 weeks on the floor, in the step down, and then released to an inpatient rehab hospital for about a month. So my summer between high school and college wasn't quite as fun as I was hoping it to be. But in doing all of that and going through all of that, I started meeting PTs, OTs, and I met other patients who had been through horrific situations as well, and relearned how to go through life with one hand. And so in doing that, it sort of sparked some interest there, but I didn't quite understand. I was still only 17 and didn't quite know yet. And so all I knew was that I didn't have any motion, any movement sensory. I had nothing in my arm at all. I couldn't move my fingers. I couldn't move my wrist, my elbow, anything. And so I thought, well, the only thing I know I can do is use my brain. So I decided to go into psychology. And but at that point, there was still so much up in the air because I had no motion. And the other issue that I had started to face is that all the musculature in my shoulder was gone. So I had no cushion or support for the hardware that they had to place to restore the stability of maintaining shoulder space. And so he started having to remove hardware and some of the screws and pins that were protruding to the end, and to make sure infection was maintained, was prevented and all of that. Well, at one point, this amazing orthopedic surgeon that I was seeing was treating me. He said, I think I've taken you as far as I can. I'd love to refer you out. There's a couple incredible people that are well known in the area of upper extremity, orthopedic surgery and neurology that you could benefit from seeing. And so, of course, I'm 17 and I'm like, okay, what do you think, Dad? And Dad's like, we have nowhere to go but up from here. Let's go to Louisville. And so we ended up going to Kleinert, Dr. Kleinert, Coots and Kleinert in Louisville, Kentucky. And this is in 1997. So Dr. Kleinert was still working and still there. And
so when I heard this story, I was like, is this the Kleinert? I'm such a freaking, I'm like, the Kleinert with the flexor tendon protocol with the rubber bands. And she was like, yeah. I was like, what? No way.
And imagine walking into that clinic. It was the most beautiful, beautiful facility. But then I'm sitting in that waiting room with all these and I'm 17. I have no idea what I'm looking at. But these splints with rubber bands and things sticking out. I was like, what is going on? And so I literally remember when I was sitting in the room waiting for Dr. Kleinert to come in, my dad was sitting with me, and he had an entourage. He had fellows and everybody. He has this entourage come in, and everyone was so incredibly optimistic, but in a very scientific way. But they said, you're 17, you're an excellent candidate for this brand new surgery that's never been done on a human. Me and Dr. Sai.
Exactly what you want to hear, right? We don't know. We've never done it. Let me do it on you. I feel so certain about my life and how my heart's going to work.
I literally looked at my dad and I was like, but my dad's in science and research and everything as well. So he thought, well, you're a great candidate. You have nowhere to go but up. So let's do it.
Your dad likes to use that. I'm going to be like, Dad, I might have to steal that. I might have to steal that.
I haven't seen that. I underwent it was originally supposed to be 6 to 8 hours. It ended up being 26 hours. And he ended up doing a brachial plexus transfer. So I believe that the original transfer, it's a little more commonplace now to take the sural nerves from your feet and ankles, which is the sensory branch, I understand. But they can provide motor. They have the functionality to be, and then you don't really miss them. And so he did a bicep transfer as well, because I had lost my bicep and he wanted me to be able to flex and potentially supinate. And so he did a bicep transfer from my pec, pulled that over, did a brachial plexus transfer in 26 hours. And so following that, I remember waking up out of that surgery and I was just completely, I don't know what's going on. I don't know what day of the week it is. I have no idea where my arm is. It's under pillows and blanket, and I had no idea. And I was not feeling well. And Dr. Sai, so he's kind of a thicker gentleman that came, he still had his mask, and he said, you move your hand, move your hand, move your hand. He was very excited, hopped up on caffeine, I'm imagining. And I remember looking down at my hand and trying to move it and actually having a little bit of motion in my for being so out of it, but just being so, oh my God, it's the first time I've been able to, and it was instant. It was an action, and was so, knowing what I know now, it's
like, it makes so much sense.
It's crazy. So following that, I ended up going to school about 2 hours away from my parents, and I followed up with care there. And I had 6 hours of therapy a week. So 2 hours, 3 times a week of PT, OT, and a little bit of scar therapy. And, which I think she was just a massage therapist, but I had about 30 minutes of scar treatment every time I went in. And so, which I thought, now I look back and I'm like, that was amazing. But the OT, I love the PTs. They were great, but it was the OT that became like a second mom to me. And she was amazing in how much she cared, but she worked so much on anything I would talk about, she ate it up. And my identity.
There's clues in what people say to you, right? just whether you're listening or not, right?
Exactly. Oh my
Everything
God.
that she was saying, like everything you were saying, she
Yeah.
was listening to, and then she transferred it in her brain and spit it back out to you in a way that made you want to keep coming back to her, right?
Oh my gosh, she was amazing. And I think I don't know if it was her demeanor that she was sort of a soft. She knew I had been through a lot. My world was completely different, upside down. And the one thing, when she started seeing I'd have those times, because it's a long road of recovery and so there were those times when I was kind of down, and I was, my life isn't what I was thinking it was going to be, and that identity issue at that age and all of that. And so
We have identity issues now. In my 40s. Like, oh my God, what am I doing? No, I'm kidding.
No, it's crazy. So one of the big things that was kind of a pivotal time for me with her was that I had said a number of times that I identified myself with equestrian science and horses and things like that. And I had a horse at my parents' house, but all of that, but I couldn't do anything. It's a 2,500-pound animal. Doing things one-handed is not going to be. So she did her own little research, found an OT that specialized in therapeutic equestrian science and
hippotherapy.
I just thought to myself, you do amazing things. She's like, well, you have a foundation in psychology. You should look into that. It's the foundation of occupational therapy. And so you could go into that. And so when I was in grad school, I remember thinking to myself, anytime that we started talking about hands or anything with the biomedical kind of approach, I was like, this is science. This feels, it's more concrete. It's more, there's more empirical. It's just incredible. And to give back the way that she gave to me, and all the people that contributed to me having, close to fully functioning arm, I have 55 pounds of grip strength, and my pinch, I just did the pinch test the other day, and I've got 13 pounds of lateral pinch. So my radial, I've got a strong medial and median nerve. My ulnar not full, never fully. I don't have.
Nerves are a little tricky, so you don't have a ton of certain types of manipulation.
Correct.
You probably need in-hand manipulation. Like move stuff ulnarly into the radial side, right? Yeah, but other than that, it's because you were lacking a little bit of supination.
Correct.
I showed trunk rotations.
Correct.
Trunk rotations to loosen up shoulder girdle. Even though the shoulder doesn't need to move that much, it loosens it up in terms of its stiffness, which then loosens up the biceps, which then allows supination.
Correct. Yes. Yes.
So we just do it every once in a while.
I have actually since then. I've started and doing some tricep work a little bit. I don't have much tricep, but I do. It's definitely, it helps every little bit.
Yeah, whatever you have. The thing with these type of injuries, right? It's whatever you have, you need to keep.
Yes. Right. Right.
So whatever you have, you need to keep. And so every once in a while, you have to have like little tune-up sessions with yourself.
Correct.
We do that with our clients in the sense that, not everyone can do everything all the time by themselves. And so our patients, our clients, once they've gotten over that hump and gotten to 100% or whatever that they wanted to get to us with us initially, they get invited back to like have tune-up sessions. Like some people can do a lot on their own, but they need little tweaks. And so we invite them back to provide those type of sessions. They're like wellness sessions. They don't need a ton of therapy. They need that critical eye to say, oh, okay, I see this getting stuck. Let's fix this now before it gets worse. Because fix it in one session, potentially, so that you don't develop more problems. Why wait until you've got 13 pounds of grip? Why wait until it's only 8?
Yeah. Yeah.
Why wait until it's only 8? Because then certain ideas get stuck like, oh, that's just the way it is. It's never going to get better. That's just the way it is. I can't get more. But yeah, so you can take that with, every time you have patients, like they don't have to just ended with you just because you got them moving. They can continue because you can keep them going. You know, the life cycle of a client for you can be forever because they can always come back to you. That's a great thing because you can just be with people who want to be with you. It's like any relationship, right? It's like any. Tell my people time. Don't be with people who don't want to be with you.
Oh my gosh, yeah. That's the truth.
Patients, boyfriends, girlfriends.
That's the truth. Oh my God.
It's the same rule.
Legitimate.
So did you always work in hands or?
Yeah, I basically right off the bat, I went into right after graduation, I started at Scripps. I'd done my level 2 field work there and I worked in neuro rehab, and I had met who would be my mentor a couple of times. It's a small hospital in Encinitas, and in meetings, I remember seeing her going, oh my God, there she is, the hand therapist. Oh my gosh, she's amazing. And I knew who she was, and I just thought, oh my gosh, she's amazing. Well, I had my CI had introduced me a couple of times, and I said, do you think I could shadow? And so she let me shadow her. She made me take some measurements, and I was so nervous, I was shaking. And then the CODA let me come and shadow her. And it was like a Saturday morning or something for a couple hours. But then following that, I had sent her a really nice thank you note, and I sent her actually some flowers.
I was just about to ask you, in a busy town like that, how did you get in? How did you get in? Because therapists are always saying, well, I don't have this opportunity. I can't get this opportunity. And at some point you have to say to yourself, what am I not doing to get opportunities? So what am I not doing to get these opportunities that I want for myself? So what did you do? You did a very key thing. What did you do?
Extend gratitude for her to giving me her time, and then showing a
How did
motivation.
you do that? How did you extend your gratitude?
By sending a thank you note.
By sending a thank you card. Dear Lord, have mercy. Do you know how many people I freaking interview that don't ever send a thank you card, that don't ever send a thank you email? Like, you don't even have to send a card anymore. It's kind of hard.
Yeah, that's true.
Most likely send an email. You know, you can send the card is huge. Anytime I get a card, I'm like so impressed.
I feel like that should be common sense, but I don't.
I am equally impressed. Not a hard person to impress, but to send a thank you email. Thank you for your time. Do you know it's not commonplace? Do you know that it's not common?
I'm sorry, because I feel like that's a very easy way to. It's so simple, and it's
so simple.
gesture.
You got in. So that is one part, right? You got in by showing your gratitude, but you secondly showed it through your motivation. Now, it's not saying I'm motivated. It's not saying I want to do this. You did something to show your motivation. What was it?
So my inner.
I knew it. There's a story. I knew it. You did something. You showed somebody something.
So I kind of cracks me up actually, because I still think I'm a dork for doing this, but obviously it impressed her, and she was very difficult to impress, this lady. But I went in my interview with her. I brought in my bag of splints that I made in grad school. In addition to, in California, you have to work in hand therapy, you have advanced practice certification. And so through our HTCA, we have advanced hands, and then you have to be certified in PAMS. So I had my applications printed out and halfway filled out with all the things that I planned on using in the next couple of months. So I already had taken that next step. She didn't have to explain that I needed that. I thought that would show initiative and motivation, in addition to.
Yes.
And then as well as showing her my splints and explaining why I like chose those ones. And I said, yeah, there's a bit of a smudge on that one, but she actually loved that because my other supervisor, who was a physical therapist, had nothing to do with hands.
Yeah.
She was excited to show him what each one was. And my interview was taken up, about 5-10 minutes of my interview was taken up with her explaining to him which each one was. So she was like on cloud nine because she loves advocating for
what hand therapy. What freaking hand therapist doesn't love that shit? Like, oh, like let me like eat it up, right? I mean, talk about, you think you're a dork. She's thinking if she's a dork, she's like, oh my God, look at these splits. I'm so, right?
Yeah.
I mean, honestly,
Oh my God.
yeah.
So yeah, it was great. I was so just, it was amazing. So she extended me an offer.
You did two major things that I think a lot of times people forget or they lack because the fear of being rejected is stronger than the initiative to get accepted.
Yeah.
No, that's hard. Like but yeah, the fear of being rejected is so strong that you almost would rather be so passive to not get rejected.
Yeah. Yeah.
Shit ton of psychology, right?
Oh my God.
Psychology background too is what brought me to OT.
Absolutely.
Yeah.
Absolutely. So yeah, it was amazing. So my first, like I said, my first 5 years of being a hand therapist were 3 days in the clinic with her, sometimes more, sometimes less, but and then one day every Saturday for about 5 years, I worked in acute care and neuro rehab. And so it was, like I said, I loved it. It was great. It was a nice extra. And then sometimes I would get pulled from the hand clinic over to across the street into the hospital to help out if they needed a splint, or doing instances for the other OTs. We're a little rusty with all that stuff. So
yeah, I tell you, it ensures some damn job security, right?
Yes, absolutely.
During this time, like who are the ones working? The ones that are versatile.
Yeah, absolutely. And I actually worked as a PT aide prior to grad school under a pretty pronounced PT who works in Sacramento now for laws and legislation. And I remember him telling me that one of the best pieces of advice, even going into occupational therapy versus PT, said if you get a grounding in a more kind of in acute care or rehab or something else, then specialize, that you'll just like you said, you'll have that much more and took that to heart. Even though I wasn't a big fan of
like it's huge. The people who have skilled nurse, like people who are in skilled nursing, like working in skilled, I'm like, good. I'm glad you're there. Like, be upset that you're not in like some hand therapy clinic. Like, good, because you can get to it. And I find that the ones that have skilled nursing facility type of training know how to work with certain hand patients that need to be taught how to get in and out of bed after shoulder injury.
Yeah.
To sleep when they have an elbow injury, like things like that, if you only did outpatient hands in a doctor's office, you have absolutely no concept of.
So
it's
true.
Huge. I mean, it depends on where you want to go. Like some people only want to do that and they're okay not being versatile, or, like, hey, if they no longer work, then it's okay.
Yeah.
But I think most OTs, want to work. I think.
Yeah.
The ones that I talk to want to work.
Yeah.
They don't want to work. They don't talk to me.
Yeah, right.
But yeah, it's a big deal to, so I encourage any kind of adult neuro rehab, skilled nursing, acute care, any kind of that type of experience. I think it really builds person's critical thinking skills to a certain extent when it comes to different injuries. You just see different things, you experience different things, and it just sort of opens your mind to that, to those type of injuries, and almost any patient that comes into your practice, not just.
Mhm.
So tell me about your journey to becoming a certified hand therapist now.
So as a new grad starting out in hands, I had my mentor kind of had a kind of a timeline that she got through HTCC that we started to use because she had actually never mentored before. And so we're both kind of on this new path. Well, I also, some people call me a masochist, but after my first degree, or after my first semester of grad school, I found I was pregnant. So I took a year off school, had my daughter, and went through the rest of an accelerated OT program as a brand new mom with a brand new infant, and finished at it was great.
Well, there's only one way up from here.
It's so true. Absolutely insane. It was insane. It was hard, but I pulled her into my peds classes, and I was like, use it, and stuff like that. So she has memory of it. But all in all, I finished grad school. Then I found I was pregnant again. And so
Keep having babies.
and literally like new grad, starting in hand therapy, big and pregnant. And I was like, okay, well, I'll have some time as, maternity leave. I'll get into studying. I'll find my path. Didn't quite actually happen that way. And so with two tiny little ones, not quite in school yet, so very hands-on, all of that, I had a really hard time with really sitting down and focusing on and finding a path and having something. I need concrete. I need something that will accountability. I needed that. My mentor did that, but it wasn't quite to the extent because we're so busy in clinic and like keeping things going. And she was the director of the outpatient program. And there was there was just not enough time in the day. And so and then I remember too when they dropped the requirement from 5 years down to 3, and I panicked because I was like, I'm not ready. I can't take this exam yet. I was thinking I had 2 years left.
There's no hard set time people have to take this, right?
Yes, exactly.
People get that, Roisin. People see that, but they set those goals for themselves and then they bury themselves under it. You don't have to do it within the 3 years. You know that, right?
That's exactly what she said. That was the first thing out of her mouth. When she said, there's no rule. You're going to have this. You're going to be held to a standard once you have this degree. Take your time. Get it right. And so I thought to myself, okay, I'll do that. And then more time went by, and I need that checks and balances. I need that person to kind of check me and like say, okay, this is the path you're going to take. This is what you're going to do, and all of that. And so then when I moved to the Bay Area, it was like 10 times worse because it's actually more expensive up here than it is.
And everyone is so busy.
Constant. And I started with the company. This company is phenomenal. I absolutely love the CEO. I love everyone that I work with, and our hand department is awesome. I love my colleagues are incredible, all the way from the seniors down to the newbies. But and very supportive, but at the same time, still can't create hours a day. 2 little kids that demand my hours during the day. I found that I'm a morning person, so I have started getting up it's usually around 4 a.m. and I give myself.
We like sisters.
It's true. It's true. I remember you saying that too, and I was like, "Yay! Okay, good. Somebody gets me," because even my own colleagues go, "God, you really are crazy." And I'm like, "Well,
you get so much done in the morning. It's incredible.
I love it. It's the best time of day." And found that past like 8 o'clock, my brain is mush, and I just can't think a normal thought. And so I thought, well, I'm just going to set this as my schedule. And so over the last, I guess, about 18 months, well, maybe not that long, but on and off. But and since I've started this program with you, it's been kind of I have to, because I have this call and I want to be able to get more out of it. I'm putting money into this and I want to be able to get more out of it. And so I need to, and so it definitely has helped with driving that kind of motivation to be like, okay, there's going to be somebody that's going to be checking in. There's going to be somebody that is made. So it's finally kind of coming to fruition, except for the pandemic, which the pandemic prevented that, pushed it off even more. But so now I'm the hand therapist 6 years later. Here I'm taking my class.
No, but it was funny because I was just talking to Nicole, and we started in February. So this is a 12-week program. It is 3 months focused every Thursday night. And if you're not showing up, you're missing out, right? Really, honestly, if you're not showing up, you're missing out. And we were so on point, man. I swear, like, I felt like so great about this program. There's a lot of people who signed up who hadn't passed in before, had failed several times. And I felt like I was giving them what they needed from me to feel really confident about stepping into that room and doing everything they could, like being really prepared, like feeling within themselves that they were prepared and having a certain mindset and problem solving, right? We talk a lot about decision, critical thinking, and then making a decision, critical thinking through this problem, and then making a decision. We talk about that a lot. And they were so like on point, and then this hit. But when I think about it, the more like it hurt all of us. Like, I'm not saying it, but it killed all of us. But the more I thought about it, the more that I felt that it was such a good thing, because your mind would not have been right.
Yeah, that's true.
Your mind, because all of this really hit heavy end of March. So we were going strong February, March, we were still doing good. End of March, it was like all hell broke loose. Beginning of April, and I know it hit my clinic mid-March, and it was hitting other people but even before then, but they were still able to go because it wasn't like, it hadn't been that bad or that long or whatever it was. Everyone was able to like hold it off. But come April, like everyone in the program, like honestly lost steam. I was the only like, okay, I got to power through.
Yeah.
To power through. I mean, I was coming to the clinic nights, weekends, studying, presenting, because I know I needed to. But I know everyone's mindset wasn't there. So I'm really happy in the end that you guys didn't take the exam. I think it would have been a crushing blow, because if your mindset wasn't there, it's hard to kind of recover from that. I think people who've taken and failed, it like hurts them really deep. It hurts when it hurts your ego, it hurts deep. It hurts your ego, it hurts really deep. I mean, but I think that come out of it now, everyone's like gotten a little rest time, right? Mm-hmm. They're having the ability to rest, but to not stop. So we're in the middle of the bridge program right now, which helps you to keep going.
Yeah.
And then August, we are back at it.
It's true.
We're back at it. So we're going to get ready, and I don't think anything's going to stop us in November.
No.
Yeah. So what has helped you the most in this program, would you say?
I think
accountability is huge. That's one of the top things most people are saying, and you were saying that, right?
Yeah, 100% agree with that, because when you don't have anything, or when you just have yourself, people I've talked to in the past, even in my early years as a hand therapist, like they really struggle unless you have someone that is saying, okay, this week we're going to talk about this, or this week we're going to talk about that. And then having you review everything prior to sitting, that's another part of it. It's not just showing up and like sitting there listening. I wouldn't get anything out of it if I did that. Like I would like maybe bits and pieces, but I wouldn't get the full value of it. It's the actual time you take to like think of questions and process things. Even if, I just had a couple things down, a couple topics that based on the week to week, okay, this week we're going to talk about nerves. This week we're going to talk about tendons. So it made this huge, wide open topic of hand and upper extremity into something small and organized. It's so incredible because if you just sit down with the purple book, it's great. But if I don't have something guiding me through that, because it's so like, I have so much in my life that's not controllable. And this is one thing that I can control, and it helps me kind of like keep me on my path. It's been so incredibly valuable. In addition to the genuine feel of like the classes itself, like I know I'm going to always laugh. I know there's going to be something fun that is like, it's very, I don't feel stupid if I ask a question. I'm like, hey, listen, I have this case. And that's always been something I've had growing up. I grew up with parents and families that are all overachievers. And so I'm quiet in like the things I don't want to say, because then I'll be like, oh my God, what are you asking? And that kind of thing. Yeah. And so it's definitely, that is completely the opposite in this case. I think it's like the more questions, the better, no matter where they come from. It could be left field. You're like, it's awesome.
You said that.
Well, it's huge. That's a very valuable thing for me. It's something I
was trying to do that, but I wasn't sure if I was successful because I want people to ask.
Well, I feel strongly encouraged to ask. Like, I feel like, I have a question. Can I, like that kind of thing. Because I know not only will you answer in a way it breaks things down to where I'm like, oh, if I kind of understood it before, I have a much deeper understanding of that foundational reason why I understood it in the first place, if that makes any sense. Like it's a really great teaching program, and just have a good way of explaining information that's very complex, breaking it down into more of a simple kind of way. So
you like that shoulder one, did you? That was your favorite?
I love
that was nice.
Oh my God.
So I curse a little bit. I make bad jokes, but I'm not that serious. I just want to have fun.
You need to, because this can be. My mentor used to say this. It's very dry. It's very hard to. She used to bring in her hand therapy journals. She'd just give them to me. She'd be like, I can't sit and read. It's so dry and boring. I'm like, you're a hand therapist. But then she's like, well, this is the thing, is that if you didn't do that, I probably wouldn't be as motivated, because I know it's going to be fun. It makes it a fun setting. It's like, that to me is important.
It'd be fun for me too. Like, I can do it. Like, I don't want to be boring.
Exactly. Well, and
I don't want to bore myself.
I don't see that ever happening, to be honest.
I just I know I do. I even crack jokes. I'm like, I'm cracking this joke for me.
I get that. I totally get you. I 100% get you. I do that sometimes with patients that are very serious. Like, I'll have a lot of patients sometimes that are very like, and especially, I don't know if it's Bay Area or, because San Diego was so much different. The demographics of my patients there were like fun and like, what are you doing this weekend? And San Francisco, it's like
more like business, engineers, and people.
That's all.
I'm in one of the lectures. I think I'm going to bring up different personality types, because I teach my staff that different personality types, because it comes back to the therapeutic use of self and how it's you yourself. You're still using it, but you're changing little things based on the person that you're with, so that it makes it easier for you.
Absolutely.
But when they're like this, then you can act a certain way. You can tone it down, and then you can tone it up. It's just like manual treatment. Sometimes you go a little bit, sometimes you go a little bit softer. But either way, you kind of know based on feel.
Yes. Oh my gosh, it's amazing. It's amazing. It's true. Oh my God.
Yeah.
So
I'm
So
gonna do
true.
a lecture. I'm gonna put that lecture up somewhere.
Uh,
I'll piece it together. It'll be good.
totally gonna use. I love that.
Yeah.
That's awesome.
Yeah. So, what would you say to anyone who's on the fence about joining the program?
I'd say it's absolutely 100% worth it in the sense that it's such a small investment to get such a big gain.
Yeah.
And the fact if you're on the fence, it's like you can do what you can do on your own, but you're only reinforcing and giving yourself more of a guarantee, more of a stronger percentage. We tell our patients that all the time, right? Like you have this person, there's more of a guarantee if you do your exercises every day, right? So if you go home and you'll get more out of it. And that
You're increasing
accountability.
your chances. Yeah, we say that to our people. You're increasing the likelihood that you're going to get X when you participate this way.
Yeah.
So that, I mean, that's the whole point of this program, is to help people to increase their chances of feeling really prepared and coming into that test like confident.
Yeah.
It's huge when you go into these types of, but being prepared helps you to feel confident.
Absolutely.
Yeah.
Absolutely.
Yeah. So it's been a fun ride. It's kind of my baby, and I've always dreamt of doing something like this because I've helped different people along the way. But the way we're able to do it now, I'm able to help all over. And I've had a huge amount of people reaching out to me from across the world. Actually, somebody told me that he's going to be joining in the August portion, but I'm opening it right now a little bit early. But he would become the first CHT in his region, in his country. Like, girl, I'm ready. Like, I'm ready to help you. Like, what do we need to do to make this happen? Like, I'm like 100. Are you ready? I'm 100% on board. I'm like, what do we got to do?
That's amazing.
This stuff excites me. I don't know. I'm one of those little geeky people that.
I know. I totally get it. I love it. I think that's awesome. I feel the same way. I really do. I think it's awesome.
And then you'll be able to, then kind of get that out in your area. Look at all the people who you're going to look at you and see you're going to be the leader in your area, and you're going to be able to help and direct them, and and all that good stuff. So it's a positive thing overall. I think it's really good.
Yeah, for sure. And then the commitment that it requires. It's not as committing as trying, even though as much as I would love to have done like a full fellowship at like Philly or Stanford or one of those places, I couldn't have done that. I had little kids and it's expensive. You don't get paid the same, but you get the same kind of quality based on your experience and your reputation and everything that it is itself. And so in the sense of, I think overall, it's such a great way to go.
You get to create your own experience. You get to create your own fellowship.
Yeah.
But you get what it is. It gives you a very solid foundation underneath. Like from the studying, understanding it a certain way, getting your CHT allows you different opportunities to open up, and then you create your own more than I think going to any fellowship. The fellowships, I think, are very limited to that town, to those perspectives, right? Absolutely. And that doesn't always lead to you getting a job in your town. You almost have to create it in where you want to live, where you want to work, and that kind of stuff. My therapist, she was looking at fellowships and stuff like that, and it took me a couple years to kind of get going before I offered one at my clinic. And I'm high paying. I'll say it right now. You come into my fellowship, you will not get paid.
That's true.
Because
they don't.
So there's so much training involved. So much. It's very time intensive. So it's hard to like give you all the money when all the time is being, so somebody's got to give a little bit to get a little bit. So it's that kind of stuff. But just like you did, what are you willing to give up, right? to get into hand therapy, essentially you're willing to give up your Saturdays for X number of years working in a certain environment that still at the end of the day wasn't giving up anything. It was
Right.
just building your skills in a different way.
Totally.
It's just the Saturdays. Some people just can't give up their Saturdays, you know?
Yeah.
You know, at some point, something's got to give a little bit. You get something else in return, you know?
Absolutely.
So it's really big. And now you're the shit in your area. And you're going to become a certified therapist. So I'm really excited. But thank you so much for sharing your story with everybody in the show. I think they're going to have a blast listening to it, and how you went from, you know, being a survivor to then turning around and helping other people survive.
Absolutely. Absolutely.
Well, thank you so much.
You're welcome. Thank you for having me. This is an honor. I love it.